Warning: watch this video or you will regret it. Breathing may seem like a simple task, but for seniors, it can be a struggle. Respiratory failure, a condition in which the body doesn't get enough oxygen or can't get rid of enough carbon dioxide, is a silent threat that many seniors face every day. However, many people only start to worry when they have difficulty breathing to the point where they can't sleep, can't eat, or even can't speak in full sentences. Today's video will help you understand respiratory failure, the causes, early signs, and prevention, because don't wait until you can't breathe to start worrying. What is respiratory failure, and why are the elderly susceptible? Respiratory failure is a condition in which the lungs cannot ensure effective gas exchange. That is, not enough oxygen is supplied to the body or cannot remove CO2. In the elderly, this is not a rare phenomenon. According to medical statistics, the rate of people over 65 years old with respiratory failure increases every year, especially in those with underlying diseases, such as chronic obstructive pulmonary disease, COPD, asthma, heart failure, or diabetes. The big problem lies in the decline in lung function with age. As we age, the diaphragm, the main muscle that supports breathing, weakens, lung tissue loses elasticity, making breathing more difficult. At the same time, weakened immunity also makes the elderly more susceptible to respiratory infections. And when they have pneumonia or bronchitis, they recover slowly, easily leading to acute respiratory failure. Another factor is that the elderly are often less active, leading to fluid retention in the lungs, thereby increasing the risk of infection and airway obstruction. In addition, some elderly people have to live in polluted environments. Passive smoking or exposure to toxic gases also increases the risk of lung damage, causing respiratory failure. Respiratory failure is not simply a lung disease, but also affects the entire body. Insufficient oxygen will cause the heart, brain, and kidneys to function less effectively, causing fatigue, confusion, and even death if not treated promptly. Warning signs of respiratory failure. Don't ignore small changes. One of the most dangerous things about respiratory failure in the elderly is that it progresses silently. Initially, the symptoms are very mild, easily mistaken for the normal failure due to age. The patient may feel a little tired after walking, short of breath when climbing stairs, or feel a heavy chest at night. However, these are the first signs of a lack of oxygen in the blood. As the condition worsens, the patient begins to feel obvious shortness of breath, especially when lying down. They often have to prop themselves up on a high pillow to sleep, or have shortness of breath when talking or eating. Some people feel anxious and restless for no apparent reason. In fact, it is due to a lack of oxygen to the brain. Other signs such as pale lips, purple fingertips, morning headaches, confusion, lack of concentration, are also important indicators of chronic respiratory failure. In a later stage, the patient may fall into a state of acute respiratory failure. Severe difficulty breathing, rapid breathing, wheezing, rapid heart rate, and even loss of consciousness. At this time, emergency treatment is extremely urgent. If delayed, it can lead to respiratory arrest and cardiac arrest. It is worth mentioning that many elderly people, because they are used to enduring, often hide their symptoms or think that this is how old people have to be. Family and children also easily ignore small changes in grandparents and parents. Therefore, careful observation of even very mild symptoms is an important way to detect respiratory failure early and intervene promptly. Treatment and care for the elderly with respiratory failure. Treatment of respiratory failure in the elderly requires a comprehensive plan, not just stopping at medication or oxygen therapy. First, it is necessary to determine the root cause of respiratory failure, which can be infection, bronchial obstruction, cardiovascular disease, or chronic lung disease, for complete treatment. The use of antibiotics, bronchodilators, diuretics, or corticosteroids must be carefully considered according to each person's specific condition. Oxygen therapy is one of the essential support methods, especially for patients with severe shortness of breath and low blood oxygen levels. However, the use of oxygen must follow the doctor's instructions, avoiding abuse that can cause respiratory depression. In addition to medication, daily respiratory care is also very important. Elderly people with respiratory failure should be instructed in deep breathing and abdominal breathing exercises to increase lung function. Respiratory physiotherapy, phlegm suction, chest percussion are techniques that help clear the airways and reduce the risk of secondary infection. Nutrition also plays an important role. Patients need to eat enough nutrients, avoid malnutrition, because a lack of energy will weaken the respiratory muscles. It is necessary to supplement with vitamins C, E, omega-3 to fight inflammation and increase resistance. Keeping the body warm, avoiding cold wind, fine dust, and cigarette smoke are also measures to protect the lungs every day. Finally, psychology cannot be ignored. Many elderly people with respiratory failure feel lonely, afraid, and prone to depression. Listening, encouraging, and creating a peaceful living space with someone by their side will help improve the quality of life significantly. Preventing respiratory failure. Take action today. Preventing respiratory failure is not too far away if we take the initiative early. First, make sure the elderly are well monitored and controlled for underlying diseases, especially lung-related diseases such as asthma, COPD, chronic bronchitis, as well as cardiovascular disease and diabetes. If these diseases are not controlled, they can easily cause complications of respiratory failure. Exercising proper breathing is a very effective measure. Deep breathing exercises every morning, combined with light walking, yoga, or qigong, not only help improve lung function, but also increase the body's flexibility. For the elderly who are less active, just 15 to 20 minutes a day will bring clear results. A proper diet is also indispensable. Avoid eating too salty or greasy foods. Instead, eat green vegetables, fruits, fish, and foods rich in antioxidants. Drink enough water, keep your throat and nose warm, especially in cold weather. Regarding the living environment, it is necessary to ensure clean, fresh air, limit dust, cigarette smoke, and mold. If you live in a polluted area, you should equip yourself with an air purifier or wear a mask every time you go out. These small changes bring great protection to the lungs of the elderly. Finally, do not forget to have regular health checkups. Respiratory function tests, blood oxygen measurements, chest x-rays, etc. will help detect abnormalities early before it is too late. Do not wait until you feel suffocated to start caring, because sometimes that is the last step in a long chain of complications that we could have prevented a long time ago. Respiratory failure is one of the silent killers of old age. Not noisy, but extremely dangerous. Only when we understand the causes, signs, and prevention methods can we protect our loved ones from this unpredictable disease cycle. Take action today so that every breath of old age is always gentle and full of vitality. If you find the video useful, don't forget to like and subscribe to receive more valuable knowledge about the health of the elderly. Thank you for watching.